Good.
Yes.
Good. Okay. Hello, everybody. So my name is Anne-Marie Hall, and I'm here to present IZI Medical, which is an American company within interventional radiology and medical devices. IZI Medical is an American company that is located in Maryland in America. There's 95 employees, and we're presented in 25 countries globally. And I am the European Business Development Manager and Distributor Support Manager, and based in Denmark, in Copenhagen. Just to give you a short overview of what IZI Medical is a company that was founded in 1994 by a neuroradiologist and radiation oncologist, and from there on it has been on an expansion journey, where in 2016 Shore Capital, they invested in IZI. In 2017 we acquired the Cook Medical's osteocyte line. In 2018 we acquired the Benvenue Medical Vertebral Augmentation System, Kiva. In 2019, we acquired Cook Medical soft tissue biopsy and breast localization line. And here in 2020, we have acquired Radiomed with the fiducial marker Visicoil. So we are on quite of a journey, and we are continuing. Just to give you an objective of why we're participating here today, it sounds like a really good event that you have, and we wish to introduce you to our company and to give you a portfolio introduction. We are also always in the lookout of extending our distributor network, where we're looking for distributors that can carry our products, the whole portfolio or partial of the portfolio, and then we're looking for independent sales agents in Germany. The three pillars that we're focusing on is the soft tissue biopsy and breast lesion localization. It is minimal invasive spine solutions, and it's radiation therapy. And I've shared with Christoph all the information, the more detailed product information, which is available for you, that you can read into detail, but I'll just go through like a fly-in on the different portfolios. So with the soft tissue biopsy, what we have is that we have the QuickCore, which is a really well-known soft tissue biopsy needle, and it comes in 14, 16, 18, and 20 gauges, and also with a coaxial needle. Then we have the breast lesion localization needles, which is the Copens and the X-Ready. We have a breast localization coil, which is the MR, and we have Jepkinski. And all of these products, they're well established already. So this is actually a legacy that is continuing, that we have gotten from Cook Medical, which is continuing within IZI and through our strong distributor network. When it comes to continuing with the good reputation that the products have, and that we always listen to physicians and what they have a feedback, just to give you an example, is that we have a hole on the little and the Tyvek bag. So actually the physicians, that they can hang the soft tissue biopsy needle. That was something that was important, and we always listen to them and make sure that the requirements is being met. The minimal invasive spine solutions, we have a very broad range within this, and this goes from the vertebroplasty, which is the traditional solution within vertebral contraction fractures, to the more advanced one, which is kyphoplasty, and also implant devices. The osteocyte line, and I don't know how many of you are familiar with this, is a very well-known line within bone biopsy. And the Murphy needle, it comes with a side bevel tip and a diamond tip, which is grounded match, so it actually reduces the pain for the patient. It comes in 11 and 13 gauge and also 15 gauge in order to accommodate surgical procedures or patients that are really small. The length of the needles, they come in 10 and 15 centimeters, and we have just recently also introduced the 18 centimeter for sacrum axis. We listen to the physicians always. It's important for us to care about them. The needle, the osteocyte needle has a radiolucent handle in order to make sure that the physician has the possibility of accuracy of placement of the needle. It also comes with a radiolucent needle holder in order to make sure that the physician actually can minimize the radiation exposure. So the needles, they are focused regarding the biopsy, but they can also be used for access and when you have the treatment itself. There we have the products, the cement mixer, and then injection system. When it comes to the cement mixers, we have here the CMM4, which is a mixer that is being used for mixing the cement and for the physicians that prefer to inject the cement through 1 cc syringes. We also have the CMM1, which is a mixer that is being used for the physicians that prefer injectors, sorry. And for the injectors, we have the HPIS Osteoforce, and we have, which is a low-cost product, and then we have the high-cost product, which is the DuraJect. And to accompany those, we have 3 different types of cement. So we have the Vertifix Plus, which is a biocompatible cement. We have the Osteofix, which is a medium viscosity cement. And then we have, and actually as the only one at the market, we have the Thermofix, which is a exothermic therapeutic cement and exceeds up to 85 degrees and is used for treatment of tumors. We have just recently launched the osteocyte vertebral balloon, and this is for the physicians that prefer to perform the kyphoplasty procedure. And this has just recently been, like 2 weeks ago or something like that, that it has been released in Europe. So we're really excited about this launch. But what it actually does is that it gives us the opportunity to meet all the requirements of what the physicians, they prefer when it comes to procedures of vertebral contraction fractures. If you go to the more advanced scale, then we have Blazer, which is a system where you have the opportunity to actually have one single axis, and there you can go in and you can create cavity within the vertebra, and afterwards you can inject the cement. And now I hope the video it works here, so you can see it. And please let me know if it works, if you can see my screen, Christoph, can you?
It is loading, yeah, still.
Yeah, perfect, okay.
We still see the presentation.
You see it?
No, still the presentation only, not the video.
It's still my presentation? Just give me a second. So just give me a second here.
Sure.
I'll try one more time.
You may also try to send me the link in the chat or to Václav, and we will share the screen with the sound.
Yeah, I have it here. Now you see it, right?
Yes, we see it.
Good. So here you create the cavity with a nitrile wire. Then you retract it.
Yeah. Amazing technology.
And then when you have created the cavity that you need, then you're able within the same single point access to inject the cement. So I will be so good at Zoom when I'm done with this presentation, huh?
For sure.
Good. And another solution that we have is the Kiva, and this is even more advanced, and this is a biocompatible implant also for vertebral compaction fractures. And the reason why this was developed is to reduce adjacent fractures, and it is to reduce the cement volume and also to reduce the cement extraction. And also here I wish to show you a video. Just give me a second.
Yeah, no worries. You still have around 8 minutes.
And you see my screen, right? Good. So this is the Kiva. So first what you do is that you introduce a coil inside the vertebra. And you can insert from 1 to 5 loops. It depends on how much restoration you need within the vertebra. And then afterwards you insert the implant on top of the coil, which is made out of PEEK material. And when you have the height that you wish for the vertebra, and you've gotten the right angle, you retract the coil.
Wow.
Then you have this, the implant inside, and what you do then is, in order to anchor the implant, you inject cement, and you inject 0.5 cc's of cement per loop. So it's nothing compared to the traditional vertebroplasty, where you inject about 6 to 8 cc's. So this is a completely new technology within vertebral compaction fractures, and it's CE marked. Good. And then, so this was the minimal invasive spine solutions. And then the latest that we have is that we have for the radiation therapy. If it would jump to next page for me. There.
I just let you know 4 minutes.
Yes. And this is the fiducial markers where you can place fiducial markers within radiation therapy for tonsils, for breast, for liver, and for prostate. And this is completely new, and we just started launching this in Europe. And I won't show you the video because it's 6 minutes, so but you can go into our webpage and you can find it at IZI.com. So how do we work? So the way that we work is that every single time that there's a new product launch, we have a video introduction where we invite of 2 groups, all of our distributors, and they can find out whether these products could be interesting for their market. Then they come back to us and they say, this sounds really interesting. And then we set up an advanced product training together with the distributor team and IZI product specialists, so they can ask all the questions and that they feel that they are equipped to go out and have dialogues, in-depth dialogues with the physicians. All our distributors, they have local relations and they are market experts within their areas. When it comes to tender support, we help them in all the way we can. We give them documentation, declaration of conformity, CE mark certification, material composition, whatever they need in order to actually go in and be able to bid under tender support. We know that all of the markets, that they're different, so we approach it with a differentiated market strategy where we work really close with the respective country and find a solution that can work for them. There's designated distributor marketing support, where for me, for Europe, there I support our distributors from a day-to-day business with whatever questions they have. And when they go out in the field, and if they have specific questions when it comes to the products, then we have designated product specialists that help them getting a reply immediately. And I want to add that we work with key opinion leaders really closely within all of our portfolios, where we have access to more in-depth dialogue, or if we need support with workshops and congresses and so forth. And you're always welcome to contact me or us. I'm the European Business Development and Distributor Support Manager, and you got my details here, and otherwise Christoph also got them. So thank you.
Thanks a lot, Anne-Marie. Really, really interesting presentation. I'm personally amazed by the technology. Really interesting. Thanks a lot. I'll have personally a couple of questions as well, but first I'd like to open discussion for the rest of the people on the line. We still have a couple of minutes, so please feel free to jump in.
Hello, Anne-Marie. I am Lenka Shibestova. I am from Asperonics, and thank you for your brilliant presentation. You have very nice products, and I have only small questions. From your perspective or from your side, who is the biggest competitor in the spine solutions?
So I would say that it is Stryker for sure, and Medtronic. They are our biggest competitors.
Okay, thank you very much. And I think that our colleague Christoph and Václav will send you a few sentences because your products are really brilliant. Thank you.
Thank you. I'm glad. I'm super glad.
Thanks.
I can confirm we work with IZI products, and it's a very successful product within our geographical area, Benelux.
Yeah, I actually wanted to build on that. Actually, all those comments, those products seem very innovative. So what is the popularity uprising and uptake of the Blazer, for example? Is
sorry, Christoph, what did you ask? Sorry.
What's the popularity uptake of the Blazer product?
Yeah, so Blazer is the one that what we have focused on was the Kiva, and now we are starting slowly to move into the Blazer. So this is completely new when it comes to launches.
In competition-wise, what is the current status of those products in the industry?
So I would say it's really interesting because there's a lot going on when it comes to the trend within this area, and Kiva is a completely new innovation. So there we need to go out and educate the physicians first, and then they take it in, and we're slowly starting right now as we speak to start having the first cadaver workshops and have the dialogues with the physicians.
Thank you.
So it's very, very new.
Okay, thank you.
But also well supported by several key opinion leaders worldwide. And that's also something I can confirm, that IZI has a very good relationships with well-known physicians within this domain. So it's always clinically very well supported as well. So I think that's an important when you launch a new product.
Yes, I was going to ask about that. In fact, I mean, it's clear listening to all of you that you're well penetrated in a number of European markets. So in terms of reference centers, where would your strongest reference centers in Central Europe be for the spinal, your spinal procedure?
It actually varies. Spain is really a strong one at the moment, I would say.
Okay.
And of course France. Of course France.
Thank you.
Okay, thank you, Jonathan. Maybe some last questions. Okay, if not, I have a couple of requests for the contact, so I'll share that with you, Anne-Marie.
Yes.
And thanks a lot once again for the presentation.
You're welcome. It was a pleasure.
Thanks a lot.